All right, now what we're going to talk about today is the target heart rate for exercise. What is the safe amount of beats per minute that your heart can go? So we want safety while we exercise. So the first thing is we're going to cover a couple of different things. So establishing the target heart rate for exercise involves a couple of different steps. One, we're going to get what we call the resting heart rate, which is just check the pulse when the person's nice and relaxed. Resting heart rate is the abbreviation. Number two, we're going to be testing the fitness level with a very easy test called the step test. And we're going to determine with these step tests how fast the heart gets going after a certain amount of minutes in a certain specific exertion. And from this, we'll be able to figure out by checking the pulse 1 minute after the workout, after the test. We're going to check for the heart rate recovery. The third thing we're going to do is we're going to calculate the maximal heart rate. And that's a simple equation, 220 minus age. Then we'll calculate the heart rate reserve, which is simply the maximal heart rate minus the resting heart rate. And then the last thing is we need to determine the zone of fitness or health. Do we have a zone 1, poor health, maybe unfit, couch potato sort of thing, or maybe an older person who isn't quite up to this at this moment? Do we have a zone 2, which is the average health, somewhat fit, not really perfect, maybe out of shape a little bit? How about slightly out of shape? And then zone 3, of course, is our excellent health person. This would be our classic fit patient or participant. So these are our goals. Let's go. We're going to figure out first how to do the different step tests. After that, I'm going to show you how we can calculate the target heart rate using these four different components. The 3 step tests that are commonly used for fitness would be the basic one, the YMCA step test. This one involves having a step that the person steps up onto safely that's only 1 foot tall. The time limit is 3 minutes. The cadence, or the beats per minute, that you can use a metronome to calculate should be 96 beats per minute. You take the resting heart rate, that's check the pulse. You have them step up, up from here to here, and then step down, down. And this is called a step cycle. Then they count up, down, and when you're doing this kind of step test, you're going to see that this is roughly a 24 steps not roughly, it's exact actually, 24 steps, and each step is 3 seconds each. 3 seconds. So from here to on top of the box and down should take 3 seconds. At the end, check the pulse. Write down that post-exercise heart rate. And then lastly, 1 minute later, check the pulse again and get the 1 minute recovery heart rate. Now, the goal is to have at least 20 beats per minute recovery in that 1 minute. They've shown that if you have a beats per minute that is less than or equal to 12 beats per minute recovery in that 1 minute, the person is at higher risk of a myocardial infarction and cardiovascular problems. So, unhappy heart. The second of the step tests is the Queen's College step test. This one was designed from looking at bleachers, and bleachers are about 16¼ in height, 16 1/4, so 16¼ inches high. So if you were wondering why such a weird number, now you know. This again is a 3-minute test. You check the resting heart rate first. You're going to have them do the step cycles. And the step cycles vary. When you're a woman, they have you do it at 88 beats per minute. And when you're a man, they suggest you do 96 beats per minute. Again, the 96 beats per minute will be roughly a 3-second step up, step down. Now, at the end, of course, you're going to do the post-exercise heart rate, and you're going to look at their recovery heart rate in 1 minute. Now, there's been studies that have shown that there's a reasonable accuracy of calculating the VO2 max using the Queen's College step test. Here is the calculation. 65.82 times the result of 0.1847 times the post-exercise heart rate for the women will give that VO2 max calculated. For the men, it's going to be 111.33 times a 0.42 times that post-exercise heart rate. And again, our goal is to get to a calculated VO2 max. The third step test I'm going to talk about is the Harvard step test. Now this one's more of one that you might see when you're using it in the fitness situation, maybe a sports fitness, because the box is much bigger. It's not just 1 foot. It's much taller. it's going to be 20 inches tall. The time is longer as well. It's 5 minutes, or to exhaustion. Now, the metronome should be set to a 60 beats per minute, and what that equals is more steps, so 30 2-second step cycles. Again, a step cycle is when you go up, up, and then down, down. So we have 3 step tests. The YMCA step test, which was a 12-inch box at 96 beats per minute over 3 minutes. We have the Queen's College, which was a 16.25-inch box over 3 minutes, and this one had a difference between the women, beats per minute, and the men, beats per minute. Then the last one we've just talked about, the Harvard step test, goes to 5 minutes with a metronome of 60 beats per minute and a 20-inch tall box. Now let's take this information and let's now go and calculate the person's target heart rate for their exercise. So we have established an outcome measure. What does that mean? We checked the step test today. We're going to put them through a safe fitness program. And perhaps, let's say, in 1 week, we'll redo the step test. This could be continued on a weekly basis, or you can make your therapeutic trial go for a longer time. I think early establishing and rechecking outcome measures is important to the patient and to you, but it is also something you don't want to do every day because then it becomes crazy redundant. The next thing is to calculate that target heart rate. How fast should my heart beat? When I exercise? First, we're going to check the pulse when the person's nice and relaxed. This we're going to call the resting heart rate. Next, we're going to calculate the maximal heart rate. And this one's going to be 220 minus the age of the person. The third thing we're going to do is we're going to calculate the heart rate reserve. This one is going to be the maximal heart rate minus the resting heart rate. So let's give an example. We have a 50-year-old female and she's of average fitness, or maybe she's just getting back into working out again. Her pulse, it turned out to be 60 beats per minute. Take her 220 minus 50, her age, and you get 170. Take that number, 170, minus 60 beats per minute, and you're going to get 110 beats per minute for her heart rate reserve. Now the next thing is we're going to save this information and we're going to go look at what target intensity should we work out with an average fitness person. Target intensity is something that we need to figure out based upon the fitness of the people we're working with. So it's based on zones. Zone 1, Zone 2, and Zone 3. Zone 1 is the person who's unfit, maybe poor health, or an older person. Zone 2 is the average person. Average health, fitness, or maybe they're returning to exercise after a few months of being lazy. Zone 3 is your fit person. This is the person with excellent health. This one right here is the one that most of us will be working in, the 75 to 85% target intensity. With the older person, we're going to want to bring it back a little bit to 65 to 75% target intensity. And with the fit people, we want to make sure they work out at the perfect level. So these guys we're going to do 85 to 95% target intensity. This is what we're going to use to figure out what the target heart rate is for that patient. So it's a patient-specific heart rate, target heart rate that we're going to be giving. The target heart rate. The original question was, how fast should my heart beat when I exercise? When I do aerobic exercise? Let's answer that question. We're going to use a formula that's called the Karvonen formula. Essentially, we're going to look at the target heart rate is a calculation where we take the heart rate reserve and we'll multiply it by the percent target intensity that we determined by their fitness zone. Then we add that result to the resting heart rate. Let's go to our 50-year-old female who had a resting heart rate of 60 beats per minute. And you remember we calculated her maximum heart rate to be 220 minus her age, 50, which equals 170. And we calculated her heart rate reserve to be the maximum heart rate, 170, minus her resting heart rate, 60, so it was 110. So let's put in her heart rate reserve. 110 times And now let's figure out what intensity we would like to have her work. Which zone do we want her to work in? Let's have her work somewhere in the mid zone of the average return to exercise zone 2. Let's choose 80%. So we're going to do 80% here. And we're going to get that result, which is 88. And now we're going to add in her resting heart rate. And that resting heart rate for her was 60. If you add this together, you get 148 beats per minute should be this woman's target heart rate. In the beginning, we're going to say to her, we would like you to start with 30 minutes a day. If she can't do that, you can back it down, decrease it, and make it 30 minutes 3 days a week. If this works fine, our goal for ultimate fitness is from 30 to 60 minutes a day, 60 being the better, of aerobic activity. For health and well-being, we need daily aerobic activity. Now let's talk about one more thing. Health-related fitness. This is actually related to several different things. The cardio-respiratory fitness, we'll put a heart around that one. The body composition. This is where we're going to calculate things like BMI. We're going to look at their weight. We're going to look at their fat. You may be using skin fold measurements. Flexibility plays a very important part. If we don't have good flexibility, we risk injury to the joints, and the soft tissue around it. Then there's two components to health-related fitness that have to do with muscles. We have muscle strength, and we have muscle endurance. In terms of reduced risk of low back pain, they've shown that endurance is very important. We also know that if you don't have muscle strength, you can't do your activities of daily living. So what we really want is the person to be able to lift up a gallon of milk without issue, to be able to carry groceries without issue, and more. We want them to be able to do much more. So how do we determine if a person can get cardiorespiratory fitness work with us? How can we decide that they should get cardiovascular exercise? Well, here's a really easy questionnaire you can use. To check for the ability to do cardiovascular, that's cardiovascular pulmonary, I wrote right there, cardiovascular, or you could say cardio, or you could say cardio respiratory fitness, to check to see if it's safe for the person to do exercise. We're going to call this the pre-qualification. We're going to give them a questionnaire called the PAR Q and U. Participation questionnaire. This is a specific questionnaire that you can get from any exercise book or even online. Essentially, there are 8 questions. If you're a doctor, you're probably going to take a medical history. You're going to be doing a review of systems, and you're going to do a physical exam. So that's for you doctors, chiropractors, etc. Now, if you're just a fitness person, perhaps you want to just use this quick PAR-Q. The first question is, do you have any known heart disease or heart issues? Have you been told don't do certain activities? Have you been told you should limit your activities by a doctor? The second question is, do you have chest pain with activity? And of course, then the third question is, in the past month, do you have chest pain while you're just resting? The fourth question is, do you have balance issues? That's changes. I made a little triangle there. Do you feel dizzy, fainting spells, loss of consciousness? The fifth question is, do you have any joint pain that would stop your activity? What kind of joints are we talking about? Back, hip, knee, etc. The sixth question is, are you on any medical drugs for heart disease or heart problems? Or maybe on blood pressure meds because you have hypertension? The seventh question is, do you have any known diabetes, thyroid issues? And then, of course, you got to ask, is there any reason you think that you should not exercise? This series of questions is going to be really good to determine basically where they stand and help you hopefully figure out what would be safe for them to do in terms of the cardiovascular exercise program you'd like to prescribe.